Here are 5 high-yield USMLE-style questions focused on cystic fibrosis. Question 1. A 4-year-old child with a family history of cystic fibrosis presents with a persistent cough, recurrent lung infections, and poor growth. The physician orders a sweat chloride test, and the results are markedly elevated. Which of the following genetic mutations is most commonly responsible for this patient's condition? A. CFTR del(F508) mutation. B. APC gene mutation. C. BRCA1 gene mutation. HTT gene mutation. ESMAG4 gene mutation. Answer: CFTR del(F508) mutation. Explanation: cystic fibrosis is most commonly caused by a mutation in the CFTR gene on chromosome 7, specifically the delta F508 deletion. This mutation leads to a misfolded CFTR protein, resulting in defective chloride transport across epithelial cells, which causes the characteristic thick mucus secretions in lungs, GI tract, and sweat glands. Question 2. A newborn is screened for cystic fibrosis with a high level of immunoreactive trypsinogen in their blood. The baby is symptom-free, but is diagnosed with cystic fibrosis after further testing. Which of the following complications is this patient at risk of developing in childhood? A. Chronic lung infections. B. Liver failure. C. Coronary artery disease. D. Chronic kidney disease. E. Cerebellar ataxia. Answer: chronic lung infections. Explanation: one of the most common complications of cystic fibrosis is recurrent pulmonary infections, typically caused by S. aureus in infancy and early childhood and P. aeruginosa in adulthood. The thick mucus in the lungs impairs clearance of pathogens, leading to chronic bronchitis, bronchiectasis, and chronic lung infections. Question 3. A 21-year-old male with cystic fibrosis presents with infertility. He is absent of the vas deferens, but his spermatogenesis remains intact. What is the underlying cause of his infertility? A. Complete absence of sperm production. B. Increased viscosity of semen. C. Absence of the vas deferens. D. Low testosterone levels. E. Testicular torsion. Absence of the vas deferens. Explanation: cystic fibrosis is often associated with male infertility due to the absence of the vas deferens, a condition known as congenital bilateral absence of the vas deferens, CBAVD. This leads to obstruction of sperm transport, although spermatogenesis remains unaffected. Question 4. A 15-year-old female with cystic fibrosis presents with amenorrhea and abnormal cervical mucus. What is the most likely cause of her infertility? A. Hormonal imbalances due to CF-related diabetes. B. Thick cervical mucus. C. Absence of the uterus. D. Obstruction of the fallopian tubes. E. Complete absence of ovulation. Answer: B. Thick cervical mucus. Explanation: in cystic fibrosis, female infertility is often due to thick cervical mucus that obstructs sperm passage. The thick mucus can lead to subfertility and amenorrhea, but ovulation is typically not impaired. Question 5. A 10-year-old child with cystic fibrosis is being treated with ivacaftor. What is the mechanism of action of ivacaftor in treating this patient's condition? A. Corrects the CFTR protein folding and trafficking to the cell surface. B. Increases CFTR protein synthesis. C. Inhibits the sodium channels in the epithelial cells. D. Stimulates chloride secretion through the cell membrane. E. Inhibits the breakdown of mucin in the airways. Answer: A. Corrects the CFTR protein folding and trafficking to the cell surface. Explanation: ivacaftor is a CFTR modulator that works as a potentiator by increasing the activity of the CFTR protein on the cell surface. It specifically helps the CFTR protein fold properly, allowing it to be trafficked to the cell surface and improve chloride transport in patients with specific mutations, e.g. G551D mutation. This is a USMLE-style question focused on the first-line treatment for cystic fibrosis. Share question. A 6-year-old child is diagnosed with cystic fibrosis after presenting with chronic cough, recurrent lung infections, and failure to thrive. The child has been prescribed chest physiotherapy, aerosolized Dornase alpha, DNase, and inhaled hypertonic saline. What is the main goal of these treatments in managing this child's condition? A. Reduce pulmonary inflammation and improve airway clearance. B. Increase CFTR protein production. C. Inhibit chloride transport in the lungs. D. Correct the underlying genetic mutation in the CFTR gene. E. Prevent pancreatic insufficiency and improve digestive function. Answer. Reduce pulmonary inflammation and improve airway clearance. Explanation. The first-line treatments for cystic fibrosis focus on improving airway clearance and reducing pulmonary inflammation. Chest physiotherapy helps in clearing thick mucus from the lungs. Aerosolized Dornase alpha, DNase, breaks down DNA in the mucus, reducing its viscosity, and inhaled hypertonic saline helps to hydrate the mucus, making it easier to clear. These treatments help reduce the risk of respiratory infections and improve lung function.